Alright, now we're going to talk about endocrine and metabolic agents. So first I'm going to go through the categories and name some drugs. See if you can remember. First, the anti-diabetic agents. We have sulfonylureas, for example, glyburide, and we have metformin and rosiglitazone, and the alpha glucosidase inhibitors, for example, acarbose, and other anti-diabetic agents. Then the lipid-lowering agents, for example, atorvastatin and cholestyramine and gemfibrozil. Next, agents affecting the reproductive system: flutamide, finasteride, oral contraceptive pills, and leuprolide. Then other endocrine and metabolic agents: alendronate, propylthiouracil, gout agents, prednisone, octreotide, vasopressin, and anti-obesity agents such as orlistat. Okay, we're going to talk about some of these. So we're going to talk about anti-diabetic agents. Let's talk about the sulfonylureas first. Don't forget about glyburide and glipizide. These are second generations. They often come up on tests. So MOA, main points here of the Lang cards: they stimulate insulin release from the pancreas through inhibition of a potassium channel on beta cells, and they increase insulin action on target tissues by prolonging binding of insulin to target tissue receptors. They reduce the serum glucagon levels. Clinical use is non-insulin dependent type 2 diabetes, not type 1. Side effects: hypoglycemia. Other: contraindicated in pregnancy. Should be used with caution in patients with renal or hepatic insufficiency. Metformin belongs to a class of drugs known as the biguanides. MOA: inhibits hepatic gluconeogenesis, increases peripheral utilization of glucose. Uses: non-insulin dependent type 2 diabetes. Side effects: GI upset, lactic acidosis. Other: contraindicated in patients with renal insufficiency, and it does not cause hypoglycemia. So thinking about the side effects here of metformin, recognize that it should not be used with patients with renal insufficiency, but for the sulfonylureas, you should be careful with patients with renal or hepatic insufficiency. Don't get that wrong. Okay, rosiglitazone. Similar drugs, other thiazolidinones, which include pioglitazone and troglitazone. Okay, remember that this is part of the TZDs. MOA: it binds to PPAR gamma, and it decreases, the end result is a decrease in insulin resistance. Uses: non-insulin dependent type 2 diabetes. Side effects: hypoglycemia and edema. So let's talk about the meglitinides. MOA, meglitinides. This class of drugs binds to a potassium channel, different binding site than the sulfonylureas, on the pancreatic beta cell, thereby stimulating the release of insulin from the pancreas, so they are similar. Clinical use is non-insulin dependent type 2 diabetes. Side effects from meglitinides: weight gain, hypoglycemia. Okay, let's see if you can recognize these these other drugs, endocrine drugs. First, propylthiouracil. Similar drugs, methimazole, MOA. This drug inhibits thyroid peroxidase. This results in the inhibition of thyroid hormone synthesis in the thyroid gland, as well as inhibiting peripheral conversion of T4 to T3. So the treatment is used clinically for treating hyperthyroidism. Side effects: maculopapular skin rash, agranulocytosis, arthralgias. Other: levothyroxine is a synthetic form of T4, thyroid hormone, and it is used to treat hypothyroidism. So just to repeat there, propylthiouracil is used for hyperthyroidism, and levothyroxine is used to treat hypothyroidism.